Good evening and welcome to the City of Olympia's virtual town hall. This is the third in the series of town halls produced in response to the COVID-19 pandemic and sponsored by the Olympia City Council. Tonight's town hall is called COVID-19 and Housing and Homeless Services. It's convened by the city's General Government Committee. My name is Renata Rollins. I'm chair of General Government, and I'm going to give our other committee members a chance to introduce themselves, and then we'll talk about what to expect tonight for the town hall. And thank you so much for joining us. We want to start with Councilmember Gilman and then Madrone.
Sure. Good evening. I'm Clark Gilman, City Council member, and I'm pleased to listen and learn alongside of you.
I'm Danny Madrone, council member, and also very pleased to be here. I look forward to hearing the questions that we have from people.
Great. And it looks like we're joined by over 100 members of the public as well. So we're glad to be here and here to inform the community about resources and assistance available to help with people impacted by COVID-19 pandemic, as well as just in this time of feeling somewhat disconnected from each other. It's a good reminder that our partners are still working together on the plans that that have been in place around homelessness, as well as adapting to the new needs in the COVID-19 environment. So I would like to introduce our moderator, who's Jay Burney, our interim city manager, as well as we have three panelists. We have Keely Marino. She's a social worker, mental health professional, and she's Thurston County's Housing and Homeless Response Coordinator. And before joining Thurston County Public Health, Keely ran Community Youth Services Youth Shelter. We also have Gabe Ash. He's also a social worker and mental health professional, and he's program manager for Catholic Community Services. Gabe's grandfather owned a small construction business building houses in Olympia since the 1950s, and he's worked towards helping people find pathways to obtaining and maintaining housing in Olympia for the past 13 years. And so Gabe is joining us from Catholic Community Services. And then Keith Staley is our interim assistant city manager here. He's been with the city for over 15 years and is currently working on housing, homeless response, and COVID-19 related issues, among other issues on his plate. So welcome all, and I'd like to turn it over now to interim city manager Jay Burney.
Thank you, Chair Rollins. Again, Jay Burney, interim city manager. I'll be serving as your moderator for tonight's broadcast. The event will last about 60 minutes, and we'll start with a brief presentation from each of the panelists, and then we'll have some time set aside for questions and answers. And so just to orient everybody, you should have a toolbar that comes up on the right side of your screen, and there's a tab there for questions. You can start typing your questions in at any point in time along the way. And when we get to the end of the panelist presentation, I will select the questions and I will serve them up to the panelists and the committee members for their responses. We ask that everyone keep their communication with each other kind and respectful. And to save time, I'll do my best to combine questions and look for themes to make sure I get all the questions posed. And if there's a follow-up needed, then I'll pose that back to the panelists. So that's your basic direction. I will keep track of time. We will need to end right around 5 o'clock because there is another General Government Committee right after this. So with that, I'm going to turn it over to Keith Staley to start the presentation.
Thank you, Jay. This is Keith Staley, Community Planning. Interim Assistant City Manager. And I first off would like to thank Keely and Gabe for joining me this evening. I can't think of two more well-qualified people to participate in this discussion, and they both bring very unique perspectives to it. And while there's a lot going on, we can't begin to share everything that's going on in regards to homelessness, housing, and our COVID crisis in this hour. So this is going to be pretty high level, and we'll move fairly quickly so we can get to your questions. I'd also like to thank our partners from Union Gospel Mission, who played an integral role in helping to establish the mitigation site back in 2018, in December of 2018. They did an outstanding job, and now we're transitioning to our friends at Catholic Community Services. So I wanted to reach back to the previous town hall meetings from April 9th in particular, but also the 16th, where our Economic Development Director, Mike Reed, spoke about the United Way and the Community Foundation, Thurston Strong and thurstonstrong.org, our business hotline, our utility and tax deferment, the governor's eviction moratorium, and the food bank and Meals on Wheels expansion that was funded through United Way, as things that we've done to begin to address the needs of our displaced workers. And we're continuing those conversations, as City Manager Bernie indicated this evening with our General Government Committee, to continue those conversations about next steps in that area. So I wanted to touch briefly on some of the work that the city is already doing or has been doing in regards to our homeless response. And while it's not directly related to COVID-19, there certainly is a lot of connection there. The city worked for over a year in developing a long-term homeless response plan. City planning staff right now are finalizing that plan and look forward to presenting it to the City Council probably in June, and of course to the community as well. The critical component of that document, of that plan, is its reliance on partnerships. And I think our two panelists that we have this evening, both Keely and Gabe, are just representative of the partnerships necessary to move a homeless response plan forward and have a positive impact on our community. So a few other things that the city has already been doing in regards to homeless response. We did establish the mitigation site in December of 2018. That provides shelter to somewhere around 115 individuals living on a city parking lot in tents and with some social services. Gabe and Catholic Community Services have recently started managing that facility, and Gabe will be able to talk more about that in a few more slides. I also wanted to mention the city's work around Plum Street Village and establishing Plum Street Village, our first tiny home village in our community. That's providing a safe place for somewhere between 29 and 40 individuals, and is being managed by the Low Income Housing Institute. And that facility came online in February of 2019. So a couple things going on here with our Martin Way property. The city bought a piece of property at 2828 Martin Way at the corner of Martin and Pattison, specifically with the purpose of developing a long-term supportive housing facility using our home fund and other state and local dollars for that acquisition. And longer term, next 2021, we look forward to a shelter coming online there that will provide supportive housing for 65 individuals along with a 60-bed shelter. But on that property, there's also a 4,000 square foot medical office building that wasn't being used. And our friends from the county came and said, we need additional space for shelter purposes because of the changing needs for social distancing as a result of the COVID-19 crisis. And we're repurposing that building now for a 23-bed shelter, and Keely can speak more to that as we move through this presentation. A couple other things that the community should know that the city's working on. We have a relationship with Westminster Presbyterian for an 8-unit tiny house village on their property, on their campus. It's known as New Hope Village, and again, there's 8 units there providing a safe and supportive environment for 8 formerly homeless individuals. We also have an opportunity here where there are 4 more units that have been recently completed by Youth Build, and they are looking for a home. So the city is actively looking for partnerships in the community to site 4 more tiny houses. A couple things in regards to our ongoing efforts, working with both the county and with the mitigation site. Early in April, late in March, we moved individuals out of the mitigation site. We moved 10 individuals out of the mitigation site who we considered to be the most vulnerable to COVID-19. They were people with underlying health issues and people who were 65 years or older into a hotel. And here is a picture of our ambassador, Teal, helping to provide meals to those individuals. We also have greatly expanded our sanitation services. Here's just a photo demonstrating that, expanding them at the mitigation site, and Gabe can speak more to the mitigation site in a moment. Briefly, a couple of other things going on, specifically at the mitigation site, new and improved. We're adding shelter boxes. These are tiny shelters built into a shipping container. Here we have a 3-unit building and a 2-unit building, and we have an additional 3-unit building that is currently in construction or in process. And those literally are being built directly across the street from the mitigation site. And last but not least, relative to the mitigation site and some improvements that we're making down there, we're adding what we're calling a shelter box hygiene unit there. It will provide 3 shower units, 1 being handicapped, and then 2 regular shower and restroom units to that facility. That will be taking place next week, the first week of May. And we anticipate adding a second shelter box hygiene unit to the mitigation site in the month of June or early in July. But that will substantially increase our hygiene capacity at that facility. Just quick shout out to our friends at LOT, the Lacey Olympia, Tumwater, and Thurston County Clean Water Alliance provided funding for all of the hygiene units in the community. There currently is 1 at Plum Street Village. There will be 2 at the mitigation site, and the county is working to site a 4th hygiene unit by First Christian Church at their shelter. So I'll now turn it over to Keely, and Keely can speak to the county's ongoing efforts in response to the COVID crisis. Thank you.
Absolutely. Thank you. Hello, my name is Keely Marino, and I am the Thurston County Homeless Prevention and Affordable Housing Coordinator, and I'm very grateful to be here tonight to tell you a little bit about what the county has been doing over the last 5 or 6 weeks. First of all, I'd really like to highlight, I've worked really closely with city staff over the last year while we both worked on our respective plans, the 5-year plan, homeless crisis response plan at the county, and then the Olympia homeless response plan. So we had many opportunities to work closely together, but never more so than now. As soon as we got word from the Department of Commerce that we must meet these 4 guidelines with a grant to the tune of $995,000, the city of Olympia and staff at Thurston County Public Health have been working pretty much in lockstep. We've been meeting almost on the daily, if not several times a day in various meetings. We are ensuring that our messaging is as consistent as possible, that we're collaborating in a way that is optimizing the funds that are available in our existing homeless crisis response system, and our communication is just really stellar. So I'm really excited about one of the silver linings of this really hard time is that our relationship together, our partnership has grown incredibly strong. So I'm very grateful for that and look forward to continued partnership. So as I mentioned in mid-March, as the Office of Homeless and Housing and Homeless Prevention, we're working dutifully with our homeless crisis response system to address a request from the Department of Commerce to just increase shelter beds in general. As we work towards those plans, all of a sudden, mid-March, we got word that we were going to receive this contract from the Department of Commerce. The Department of Commerce were prioritizing counties that were working very closely with their largest city, which I just mentioned that was absolutely already in hand, and that these dollars must be utilized in these and address these 4 guidelines. So one being to promote social distancing amongst individuals experiencing homelessness or individuals that do not have a place to isolate because they do not have a home or a home-like environment to isolate or quarantine in. And that we took very seriously. That was definitely a priority for Director Shelley Slaughter of Public Health. She absolutely wanted us to heighten our hygiene. So we drafted a contract with the City of Olympia to distribute portable toilets, hand washing stations throughout and strategic locations to target areas where there's high frequency use by individuals experiencing homelessness. We drew up a contract and amended a contract with Partners in Prevention Education. Over the last year and a half or so, Partners in Prevention Education have been providing activities, providing survival gear in encampments for people who do not have a home or unhoused neighbors during hazardous weather events. We have extended that contract to include COVID response, and they are out on the daily in close partnership with multiple providers, including the City of Olympia, to ensure that our unhoused citizens can remain safely in place, that they have access to water, to hygiene, information. We have a weekly digest going out now that's been spearheaded by Partners in Prevention Education and is getting into the hands of individuals in those encampments. The second, to support existing shelters to move to 24/7 operations and to meet social distancing guidelines, which we did immediately. Our homeless crisis response system is pretty impressive, and another silver lining during this really difficult time is just to watch and witness how our homeless crisis response service agencies and our local jurisdictions just stood up and walked forward and are continuing to walk forward on the daily to ensure that they're doing everything they can to address the needs of people during this COVID crisis. So increasing shelter to 24/7 meant increasing contracts, which we did with that Commerce grant, and meeting social distancing guideline meant that some of our shelters had to displace some of their residents due to social distancing. One of those shelters was the Interfaith Works Emergency Overnight Shelter, and guideline number 3, to increase the amount of shelter space available, is exactly what Keith was referencing in that slide around 2828 Barton Way. Understanding that there would be displaced individuals who are highly vulnerable, we moved incredibly swiftly within 10 days to stand up a completely new shelter to ensure that those folks that were being displaced from shelter would have a place to go. And then finally, identifying staff and locations for quarantine and isolation beds. This has been quite an effort, and I'm glad to say that we've come quite a ways in identifying how we were going to respond to this requirement around quarantine and isolation. We have at the county, at the Emergency Coordination Center, with the incident management team and the emergency management services, have created a plan for quarantine and isolation. We've identified a facility, we have transportation figured out, we have food that will be delivered to folks that need to quarantine and isolate. Secure storage is well in hand, as well as where pets can go. If there are people who need to isolate and are not able to bring their pets, we're working very, not 24/7, but it feels like it, on how to ensure wraparound services for people who need to quarantine and isolate, to ensure that people with behavioral health needs are getting their needs met, and other specialized populations. One exciting element is that we already had a hotline in place here in Thurston County. We have the emergency shelter hotline or the coordinated entry hotline. So we just added an additional option to that phone line where you to call it there is an option to get in touch with our quarantine and isolation coordinator. That person is Ariel Benson. She works in my office, and she has volunteered to take on that role. And what that means is homeless service providers or medical providers can call that line, get in touch with Ariel, and Ariel can do a little intake process, a little bit of a needs assessment. There is an ROI in place, that's a release of information between and the county, in order to ensure that we can provide the most effective service for individuals needing quarantine and isolation. We can also get them transportation to testing sites through that number as well. So we're very excited that Ariel has offered to give her time to that effort, and we're pretty much ready to go. So that's a little bit of what we've been up to. It's been quite an undertaking. No community has ever done this before. No county has ever done this before. And I would say that I'm pretty proud of the efforts that we've been able to do in conjunction with our partners. That's all. Thank you.
All right. Thank you, Keely. We'll move on to Gabe.
Great. Yeah, I'm Gabe with Catholic Community Services, and Catholic Community Services is a large private nonprofit serving a wide array of services throughout Western Washington. And I was asked to talk about 3 of our programs today, specifically here in Thurston County, starting with the mitigation site. So as of April 1st, CCS took over on-site management of the mitigation downtown Olympia. We have at least 2 staff on site 24 hours a day, 7 days a week. CCS runs a somewhat similar site in Tacoma called the Stability Site. And that site has been very helpful in helping us learn some best practices and things that they've tried and failed, and the successes from that site that we're implementing now at the mitigation site. Just a quick grateful to the Union Gospel Mission. They've been very helpful in helping us transition into this role as they've passed the site off to us. So we're grateful to Skip and Pastor Steve and the folks over there at the Union Gospel Mission. Some of the things that we've implemented, we are working on implementing a clear path to get into the mitigation site. And so we will be reaching out to the coordinated entry provider to try to set up a priority pool so that folks will have a formal way to move into the site. So we're working on that, developing that now. Our main focus initially is just building relationships with the individuals that live on site and helping them organize and create a resident council so that they can help have a voice in how they want their community to be. And definitely they want a safe and clean environment. So we've been helping support them clean things up. And we're really excited with some of the things that some of our partners do, as far as what Keith talked about earlier, bringing in hygiene, shelter boxes and things like that is going to make a huge difference for the folks that are staying at that site. Other things that we're working on is we're trying to make the mitigation site a very welcoming place for other community partners to come in and provide services at. So we've already had Northwest Resources there offering pathways to treatment and ongoing therapy and mental health services. We've had Sidewalk that are helping us with the stimulus checks, helping people apply for that. And we hope to continue to bring in other service providers. We're doing intakes with each individual, setting up individual housing plans with people so that we can try to find out what their goals are and help them build pathways to more permanent housing. We're also just we're working to leverage the funds that we have to operate this to bring in 2 additional staff that would be outside funding. So we're close to bringing in a foundational community support person that would be specifically dedicated to the mitigation site to bill Medicaid for their work in helping people find housing. And we'll also be bringing in a dedicated peer navigator that will be outside funding that will be dedicated to working with individuals on the site. So we're excited about working on that in the near future here. With our COVID response at the mitigation site, we're screening participants. We've got a no-touch thermometer. We're asking screening questions, and thanks to what Keely mentioned earlier, the coordination, we have a pathway. If we do identify that has symptoms, we can have them screened, we can have them transported. And so appreciate the county and others' work on giving those of us that are on the front lines a pathway to get people help if needed. And that is the mitigation side. The next program I was asked to talk about is the Familiar Faces program. Familiar Faces program started as a partnership between Catholic Community Services and the Olympia Police Department in November of 2018. That was a pilot program initially that we applied for and got funding. And so since time, we've had 2 peer navigators working out of our CCS Drexel House office, but doing outreach to individuals in the downtown Olympia core that have the most severe behavioral health issues and take up the most emergency city and police time. So we have a smaller caseload and do very intensive work. And that program has seen some amazing success. Some individuals that have been, if you've been downtown, you would have seen them homeless for years. And those people are now, well, some of those people, I should say, are in permanent housing now through the hard work of our peers. So that's been exciting. And building off of that success, the police department in partnership with CCS applied for expanded funding. And that funding is coming from WASPIC. And our grant application was successful. It was a competitive grant, open statement. And so we're finalizing contracting with that. And once that's done, we'll be hiring 4 additional peer navigators, 2 mental health professionals, and a program manager, and we'll also be leasing office space. And we'll be expanding the work. It will go beyond just the downtown core of Olympia and be able to go out into the neighborhood patrol area and throughout the city. So we're excited to expand the good work there, and super appreciative of all the agencies that are supporting us in that work, especially the police department, who is doing amazing work connecting us to people in need and meeting with us weekly and helping support that work. So we're really excited about that expansion. That will be in the next couple of months that we'll be hired up and launching that, or probably sooner, actually. And then the final program to talk about is the Community Kitchen. So the Community Kitchen is one of the largest prepared meal programs in Thurston County. We have over 680 volunteers there from all different organizations and individuals throughout the city that volunteer and help us serve, and will prepare meals. And we serve somewhere around 150,000 meals per year, year in and year out. It's open 7 days a week. We normally serve 3 meals a day every single day. And we are partnered also with the Salvation Army. We are in their building and appreciate the help we get from them. Just recently, because of the pandemic, we've had to change our model of service so that we can't serve in our dining room. We're serving to-go meals only out the back garage door of the Salvation Army building. So we're still continuing. We serve meals every day, and we're serving about 400 meals a day. And then we partnered, we're expanding our services from the Community Kitchen. So we partnered with Thurston County, as well as we got some funding from the Community Foundation and United Way to respond to the need for additional meals for those individuals who are homeless, sheltering in encampments or in shelters where we want people to be able to stay where they're at and not have to travel to get food. And so starting this week, working on hiring, but we started this week now sending out meals in addition to our normal on-site meals. We're sending meals out with outreach workers that will go to tent encampments. We're going to start on Friday serving meals to Martin Way, or Interfaith Works new Martin Way shelter. And we're going to be serving and sending meals to the mitigation site. And we're also standing ready if the county needs us to serve at any other spot, including isolation or quarantine locations, we can ramp up to do that. So that'll nearly double our output of meals per day from the community kitchen. And it's just been a really amazing time where all the service providers have been coming together and working very hard together to try to make sure all the needs are met. And the collaboration and people stepping up to do more work than normal has been really inspiring to me. So I just have appreciated everyone and the work that's being done to try to meet the needs.
Great, thank you, Gabe.
Okay, well, I want to thank our panelists for your brief comments there and providing an overview. So now is the time for the community members to ask your questions. I've got quite a few already queued up here, so I'll start in, but just want to remind folks that over on the right side of your screen, there's a control panel where you can type in your questions. We will get through as many as we can. If we don't get through to your question tonight, we're capturing all these questions and we'll be looking for a way to answer them and put them up online at a later date. The first question that's posed is around communication protocols for the homeless community. So how do you know if you're reaching them so that they know where the services are provided? So if you could talk maybe for a minute about communication protocols with the houseless community.
Keely, I think that would be a good one for you to respond to with the increase in our outreach services.
Absolutely. So we have a group of agencies that come together on a weekly basis. They're Outreach Workers League, and they are actively working to create written brochures and also coming up with talking points, checking in on what is the most recent guidance around COVID-19, and they are spread throughout the county. Every day, at least 2 or 3 encampments are being reached with survival gear as well as with information. As I mentioned very recently, this is the second week we've had a digest. That digest has resources and referrals to what services are available. It also has very specific information around COVID response, as well as signs of what COVID symptoms might look like, and then where to get tested and how to get tested, and the phone number that they can call the QIC, the Quarantine and Isolation Coordinator, to get access to testing or quarantine and isolation should they need it. So I'd say that is one of our, I'm very proud of that effort. It's pretty immense, and I know that it's spread throughout Lacey and Olympia as well as into Tumwater. We don't have anyone right now going out into Yelm, but.
Okay, thank you. Second question might be for you, Keith. There's concerns that our current mitigation site doesn't appear to be large enough to meet the needs of what might be needed in the community. Just any plans for expansion or new sites in the future?
We're continuing to talk to our friends at the county about the potential for a second mitigation site, but frankly, right now, the ability to stand a second mitigation site up is really difficult, just given our constraints around funding and siting a facility. We also really do not want to disturb people at this time and move people into a new facility that we would have to manage actively. That's why we've increased our shelter-in-place services and our outreach services directly to people living in encampments and in areas outside of downtown.
All right, thank you. Third question is around testing, and wondering if there's any testing being done within the vulnerable populations in the homeless community at this time.
There are plans. We've been working on creating a team of individuals to go into the encampments. I know that will become increasingly easier when we have access to more tests. And then we will be prepped to either take people directly to quarantine and isolation should they need it. So we're definitely working on that. We should have an answer by the end of this week.
Thank you very much. Okay, next question is around, a couple questions around personal protective equipment. So this first question is, could you talk about the masking requirements for shelter spaces and supported sites? Are folks being required to wear masks, or are the providers wearing masks? If you could talk for a minute about those protocols.
I can just give you an example from Catholic Community Services. So we have had some amazing volunteers make hundreds of fabric masks for us after that was recommended. And so are giving out masks to those that are staying at the Drexel House shelter, as well as those at the mitigation site. We have enough for everyone currently, and we have a protocol to wash and return or exchange those masks daily, as they are fabric. And all staff within Catholic Community Services that are doing direct work are asked to wear masks.
I will say that every shelter and service provider that is providing services to our houseless population are wearing personal protective equipment, some of which has been donated, as Gabe said, by community members, and through resource requests at Emergency Management. We've been able to distribute surgery masks, gloves, goggles, Tyvek suits, and also dust masks to the entire homeless crisis response system, and are able to make those requests on the weekly.
All right, thank you. And a related question, which I'll be happy to answer, it's around our municipal first responders, police and fire, and whether or not they have appropriate and adequate supplies of personal protective equipment. And I can report that they all do, that all of our police officers, when they are going to any close contact, are wearing masks, as well as our fire department and medic personnel. And at this point in time, we have all the supply that we need. We have an adequate supply. We don't have any shortages at this point in time. So our next question is around the balance point between homeless services and public safety. And this question is around, can you talk about the partnerships and coordination with homeless service providers and public safety professionals, and how those conversations occur?
Well, I think I would look to Gabe first, but of course, in the past practice at the mitigation site, our police force was a regular visitor at the mitigation site, and they certainly are welcome and will continue to be welcome with our new provider there, Catholic Community Services. Gabe, do you want to provide some more details?
Yeah, well, thanks to since November 2018, when we started the Familiar Faces program, which again is a close partnership between the police department and Catholic Community Services. We meet with the police department every week. We have a standing appointment, and so sometimes if they have individuals that have been taking up a lot of their time or causing behavioral issues in the downtown core of Olympia, they will bring them to attention. They'll refer them to us and put them on our caseload, and then we'll start really intensive work with them. But through that, certainly we have a very close relationship with the police department. We know who the key players are, and we can they can share information and concerns with us, and we can do the same with them. And so they've been really good to work with.
I know in Lacey, Mitch, there's a gentleman named Mitch, and I'm forgetting his last name all of a sudden, but he works with Lacey PD and with Community Action Council and provides outreach and service connection. So I know that in Lacey that is also being addressed. And then at the Emergency Coordination Center, there's a weekly meeting with all of the emergency and first responders, and they meet to coordinate with the emergency management services folks to ensure that their coordination is well in hand.
Okay, thank you. For Keith, this one's for you. Could you talk for a minute about the support services provided to the residents of Plum Street Village?
Sure. We have a contract with the Low Income Housing Institute to manage that facility. They have staff there on a 24-hour basis, 7 days a week. They also provide a meal service from our friends at Union Gospel. So individuals there get a meal a day, and they also connect with a social service provider on a weekly basis for case management. And then, you know, other case managers and social service agencies come in on an as needed basis.
Thank you, Keith. I have a question here around the food supply chain. So as we're providing a lot of these services during this time of crisis, and food supply seems to be a big need. Concerns, or can you talk a minute about the food supply, the current food supply serving Thurston County?
I'd ask Gabe to jump in on that one, Jay, with his familiarity with the community kitchen and maybe with the food bank.
Yeah, so all the food service providers in Olympia are very well coordinated. So we work really closely with the Thurston County Food Bank. We work closely with Senior Services, and we talk to Union Gospel Mission. And so early on during the pandemic, we were getting we were going over and sort of gleaning at the food bank and getting items that they were having large donations of, and using those in our meals. And so and same time, sometimes we'll get donations that we can't use in a prepared meal setting, and a food bank setting would be better, so we would share food with them. And many of us are connected to Food Lifeline and are members of that, so we can get food from them. So we do a large effort to what we call rescue food. So we'll rescue food from different restaurants, or large meal programs like Bon Appetit at St. Martin's University, for example. Food that in past years would have just gone in a dumpster. It's still good food. We rescue that and implement it and use it in our meals. And so some of that has gotten tighter because there's not there's not as many meals going out from restaurants. There's not as much food. And so we're just having to coordinate more than ever now with our other food service partners, and just making sure we're sharing information and knowledge. But so far we're doing good. It just takes a little extra communication.
I guess I would add to that also, thanks, Gabe, but I would add to that the food bank and the South Sound Senior Services, our Meals on Wheels program, continue to look for and need volunteers to help manage the workflow there. They have, in some, our South Sound Senior Services is no longer open for their daily meal service at the Olympia Center. So the Meals on Wheels program had to expand pretty dramatically. The city put $50,000 into the United Way early on in this, along with the county and Lacey and Tumwater also providing funds there to help expand those services. And later this evening, the General Government Committee will be talking about some potential allocation and reallocation of CDBG funds to help meet those basic needs like food and shelter.
And Keith, you just mentioned, I think you just mentioned the United Way Fund. So there's a question here about resources available for people to help them pay their rent. That'd be a good source for that, right?
Absolutely. People that are struggling with rent, first thing, of course, is to connect with your landlord and have that conversation. But secondly, you can reach out to the United Way, and they do have some gap funding available. And again, later this evening, we'll be talking with the General Government Committee about potentially additional dollars flowing towards United Way and towards other community needs.
Thank you, Keith. I have a question here about those in the houseless community and where they receive medical attention and how those needs might be being met.
Keely, you want to take that one?
Sure, and I'm not going to have a definitive answer necessarily, but I will say that I was on a phone call at the earlier part of this week, and the St. Pete's Emergency Department reported that there's actually been a significant decrease in people accessing the ED, which is quite surprising considering COVID. A lot of individuals, I think, are pretty scared, and they're staying in their encampments or they're staying in their shelters and are really scared about contracting COVID, and that's kind of anecdotal. So that's just how I understand the community and just anecdotally what I'm hearing from providers. Excuse me. So some individuals do have primary care providers. Those who were accessing primary care at community care center can still meet with their primary care provider. It is an appointment-based system, and providers outside of community care center are working to help connect their participants with the CCC in order to continue their primary care. So I think it's a combination of individuals accessing the emergency department at a lesser rate, folks kind of staying where they're at because they're really scared about the virus, and then others accessing it in normal ways that they have before, urgent care or going down to the CCC.
I'm glad that you mentioned the community care center, Keely, and the fact that it is closed. The day room is closed right now, but the services are still available on an appointment basis.
Okay, I have a question around volunteers. Is there still a big need for volunteers right now? I think the person asking the question was concerned that maybe because of people that might be medically vulnerable, we may have lost some volunteers that normally would be around. And where can folks, if they're interested in volunteering for any of these efforts, is there a place they can connect?
At least my understanding is that the United Way can help connect people to volunteer opportunities, or you can contact directly the food bank or South Sound Senior Services if you're interested in providing or assisting with the Meals on Wheels. They obviously need people who are capable of driving. It really is a low risk environment. You are driving your vehicle and dropping off a meal. You are not contacting or interacting with individuals directly. So it's low risk from and high social distancing. So there definitely are opportunities out there. Again, I think the United Way is probably a good source for understanding what they are, or reaching out directly to Food Bank, South Sound Senior Services, or other not-for-profits that are looking for volunteers. I know that the folks over at St. Michael's, for instance, are operating a hygiene facility from 10 a.m. to 2 p.m. Monday through Saturday, and they are often looking for volunteers to help facilitate that resource. It's a valuable resource that we are transporting individuals there for hygiene facilities and services, but having additional volunteers at St. Michael's certainly would be valuable to them to allow them to provide those services. They also have need for volunteer at their shelter. I can't say enough about St. Michael's. This year, they have dramatically stepped up their participation in our access to services for our homeless community. They're sheltering around 30 individuals on a nightly basis, and again, they're providing the hygiene services. So there's a few opportunities, and I'm sure there's many more.
And I'll just throw in a plug for the community kitchen. Could use volunteers, especially volunteers that can come routinely, not just a one-time volunteer, someone we could train to do a task and repeat that weekly, along the same lines as what Keith mentioned. So thanks.
Okay, we are at the magic hour. We need to start to wrap this up because there is a general government committee meeting that starts right at 5 o'clock. I know there are questions out here that we did not get to. I did my best to try to look at the themes and ask similar questions. We will do our best to answer all these questions and get them posted up on our website just as quickly as possible. So with that, I'm going to turn it back over to Chair Rollins for closing comments and wrap up.
Great. Thank you so much, Jay, and to all of our panelists, Keely and Gabe and Keith. Did any members of the committee have, we don't have much time, but a question for the panelists or closing comment?
Yes.
Okay.
If I may. First, the presentations this evening really underscored the value and the power of partnerships. There's a lot more we can do working together with all of the local governments, the faith communities, and non-governmental organizations. And I think that came across really strongly. Our commitment to those with the least resources is unwavering through this crisis. And the last thing I'd say is I hope that this crisis illustrates to us both sort of the magnitude of the impact on people who are most vulnerable, and also our opportunities to act together in ways that we haven't done before to take care of everybody.
Thank you. Councilmember Madrone? I think your volume's not. Oh, darn. And the only question I had, Keith, was you mentioned the 4 tiny homes available to go somewhere to become a tiny neighborhood. What kind of partners or properties are eligible to host something like that?
Well, obviously, we'd like to have a property that's large enough to accommodate the 4 units. We'd love to have a church or religious institution that can support the facility. Westminster's been successful because the congregation's participating in the lives of the individuals who are living there. The same goes with First Christian Church that's hosting some individuals living in their under their parking area. So that's the ideal situation, but there certainly are others, and we're open to discussions with any organization that would want to play a part in establishing a tiny house village.
Renata, can you hear me now?
Yeah.
Okay, cool. I've had some technical difficulties throughout this virtual town hall, so I don't know what's going on, but these headphones are seeming to work right now. I just wanted to thank the panelists again and the staff at the city for getting this together. And, we've had over 150, 160 people tune into this. It's obviously an important issue to a lot of people. It's been a very, very hard issue for our community, and the landscape around it has completely changed, especially with a stay-at-home order when we have many people in our community who don't have a home to stay in. And so I would just ask of the community for, plenty of grace on all sides of this issue as we work to figure this out, because everything that we've been working on has changed, and everything going into the future is going to be very different. So please keep engaging with us. Let us know what you're thinking. Let us know the issues that you're seeing that we might not have noticed as a city, and we'll move forward together.
Great. Thank you so much. And with that, I think we'll go ahead and close up. I'd like to remind folks that the next town hall coming up is the 4th and final in the series. That's going to be on renter issues, housing, mortgage relief, and resources. That's a week from today on Wednesday, the 29th, and that's at 4 p.m. You can register for that on our website as well with the city. That's convened by the Land Use Management Committee. And other than that, we continue to maintain our physical distancing and washing hands and not touching our faces and all the right practices, and we'll flatten this curve together and get back to some semblance of normal as we can. So thanks again for joining us, and we'll see you all soon.
Thank you.
Okay.
Hey, it's the same meeting. Yeah. Okay.
So we have to log into a different meeting?
Yes, you have to find your other link that's from City One to General Government.
Okay.
Back.
Yeah, thank you, Debbie.
Well done.